Next, we'll move on to the next DNA virus which causes cutaneous infection, that is pox virus. Pox virus can be orthopox virus, parapox virus, and molluscum contagiosum virus. The most common pox virus is molluscum contagiosum virus. Other viruses include cowpox virus and orf virus. Okay, so these are the pox viruses which can cause cutaneous infections. And for the most common pox virus is Molluscum contagiosum, is caused by Molluscum contagiosum virus. It is of four types. The virus is of four types, MC1 to 4. One is more common in children, and two is more common in adults. Okay, and they get transmitted by fomites and sexual contact. So in children, they get transmitted by fomites, and in adults, it's by sexual transmission. So these patients who are having molluscum contagiosum will have these pearly umbilicated papules. Okay, they have pearly umbilicated papules, and the site of distribution varies between children and adults. And mostly in children, it occurs in the head and neck area, mostly over the face, whereas in adults it is in the genital area. Okay, and they also undergo spontaneous resolution over a period of months. And how do you diagnose it? Like, you can take a smear, prepare smear, and you can see Anderson Peterson bodies, molluscum bodies. Okay, and treatment is usually by curettage or extirpation, or by chemical cautery like TCA, trichloroacetic acid, or KOH, that is potassium hydroxide. Okay, this is about Molluscum contagiosum virus. And it's just Ecthyma contagiosum. It's caused by ORF virus. Okay, do not confuse this with ecthyma or ecthyma gangrenosum. Ecthyma is a deep bacterial infection, and the ecthyma gangrenosum is infection secondary to Pseudomonas infection. Okay, in immunocompromised hosts. So ecthyma is deep bacterial infection. It's caused by Staphylococcus or Streptococcus. And ecthyma gangrenosum. Ecthyma gangrenosum is caused by Pseudomonas. And this is usually due to the contact with infected animals like sheep and goats. So you see a single solitary papule, okay, and this will be tender on touch and which might bleed easily. So solitary papule, usually seen on dorsum of ants, and they are tender and they bleed easily. This is about Ecthyma contagiosum. Next is Milker's nodule, which is due to cowpox virus, and this also has similar manifestation that of ORF virus or Ecthyma contagiosum, and it's usually transmitted directly by direct contact with cow's teats, direct contact with cow's teats, or otherwise in indirect contact with contaminated objects. Okay, this also is a solitary papule, and this allows tenderness, and this is all the dorsal aspect. This is about Milker's nodule, and this is all about the pox virus. The three manifestations of pox virus include Molluscum contagiosum, Ecthyma contagiosum, and the Milkus nodule. Next, we'll talk about the hand, foot, and mouth disease. So, this is the last of this topic. Hand, foot, and mouth disease is usually caused by the RNA viruses, that is picorna virus. The two members of the picorna virus is Coxsackie virus and enterovirus. Coxsackie virus is variant is A16 and enterovirus is E71. Okay, and it's usually occurs in children in less than 10 years of age. So these patients have prodromal symptoms of fever, malaise, myalgia, and followed by that be eruption. So patients have macules which will have papillovesicles. So as the name suggests, they are distributed over the hands and feet. The palmar aspect as well as in the dorsal aspect as well as in the oral mucosa. So they can get distributed in the buccal mucosa on the palate. So and feet and mouth disease. Okay, and they usually they form erosion and they heal with spontaneously over a period of 7 days. Because of the oral mucosal involvement, the patients might have difficulty in eating and drinking fluids. Okay, and sometimes, very rarely, there might be involvement of the gluteal region, as you can see from this picture. So there is involvement of the hands and feet, and usually oral buccal mucosa is involved. Sometimes, rarely, gluteal region can be involved, and they can lead to dissemination to the CNS. And this is more common if infected with enterovirus E71. Okay, and how do you treat? You just give them antipyretics. Okay, and if it's itching, you just give antihistamines and symptomatic treatment. So this completes the topic on viral infections.